Hello, this is Dr. Angela, and I'm here with Jenae Ciuffreda, and we are going to talk about the benefits of breastfeeding. And a lot of us know the benefits of breastfeeding, a lot for the milk, the quality of the milk, how much that is so important for our children. And we're going to spin it too so that we learn about the muscles and the face and the jaw and the teeth and how breastfeeding is so important for that. So first, I'm going to introduce you to Jenae Ciuffreda. And Jenae, I'd like you to let our moms and our parents know a little bit about how you started in this field and some of your passions and what drives you.
Great. Yes. So I started out as a dental hygienist, and I was driven to my first myofunctional therapy course for orthodontic relapse cases, which is basically teeth that haven't stayed in the place that they should, and I was worried about my patients and wanted to help them with that. And I remember going to my first class and sitting in that class and being floored about how many things in our body can benefit from healthy oral rest posture and muscle development in the head and neck. So that opened me up to a whole world of education where I have taken now 20 different certification courses in breathing and muscle development of the head and neck and how we should function, and that really has led me to where I'm at today.
Awesome. 20 different certification
Yes.
courses. That sounds awesome. So learning, you are driven just to learn and help,
Yes.
so that you can be more and more benefit to
Yes.
the patients that you serve and so on. Yes, awesome. And same thing, I am such a learner that many people know many times if we're closed on a Friday, it's because I'm at a conference and learning something new.
Yes.
Awesome. So let's talk about some of the bony muscle oral benefits of breastfeeding. Tell us some of the basics and then move into whatever area of oral health you think is important for our moms.
Absolutely. So there is a lot of information out there on the benefits of breastfeeding. You can find it anywhere online, and it's we know that breast milk is so important. And when you look online, you see that breast milk is important for its nutrients and for the nutritive value of the breast milk, which is very, very important. But what you don't hear a lot about is the benefits of the muscle development as a child is breastfeeding. So as a baby breastfeeds, they use their tongue in a certain way and their cheeks in a certain way and their lips in a certain way that all helps form their face. And it helps develop their muscles so that their muscles can form their face. So if a great video to look up on YouTube is an ultrasound of a baby breastfeeding, and you can actually see what the tongue is doing to push up into the roof of the mouth and express the milk back out of the nipple. And that up and back motion develops the tongue muscle, which is a group of 8 muscles that needs to form correctly and be strong enough to be placed in the right place in the mouth to form the bones. So that is a huge piece of the benefit of breastfeeding, is the way the child breastfeeds from the nipple.
Right. Wonderful. Mm-hmm. And so there's an ultrasound that we can see on YouTube.
Yes.
That actually shows the action of that tongue muscle.
Yes.
Which is, you said 8 different muscles,
yes,
right?
The tongue is 8 muscles.
Yeah, and controlled by nerves that come from the upper part of the spine and from the brain and the cranial nerves themselves. So all that is such an important factor. 8 different muscles. Think of if you want some strong muscles, what kind of weight training do you have to do for muscles? And then we need to do that for our face as well, because as the tongue rests on the top of the mouth, then that starts to create some shape for the teeth. Is that right?
That's correct. Yes. So as a baby's breastfeeding, they're using all 8 muscles of the tongue, the tip, the middle, the back of the tongue, and they're developing those muscles so that at rest, when they're putting the tongue in the roof of the mouth, which is where the tongue should rest, it's actually shaping the upper arch. So as the palate forms, which is the upper arch, it's forming around that tongue, and that's really what we want. When the tongue is low, the cheeks press in on the upper arch, and it creates a high, narrow palate. And if you think about it the skull bones, the roof of the mouth is the floor of the nose. So if you have a high, narrow palate, then that infringes on the nasal airway space. And if the upper arch doesn't grow to its full development, the mandible, which is this big lower jaw, doesn't hinge into a correct position, and then you have an upper airway that's restricted. So a lot of kids suffer from breathing problems, and adults suffer from breathing problems from an undeveloped airway.
Interesting.
And the tongue develops that because it develops
Wow.
the upper and lower arch, which determines the volume of the airway.
Wow. So an airway being the nose, right?
The nasal passage, and then all that airway that goes down. So that whole upper airway.
Wow.
So there's the nasal passage, and then behind that, which is behind the upper and lower jaw.
Right. Awesome. Okay. So then our next question is, what about contrast the bottle feeding? So in bottle feeding, what's different? What happens that maybe is less desirable than breastfeeding?
So anything that we put in the mouth that's artificial is going to push the tongue down. So a breast nipple is very supple, and the baby is able to push that nipple into the roof of the mouth. And if you watch that video, it pushes it into the roof of the mouth, and then there's this wave motion of expressing milk out of the nipple. So the whole nipple is squeezed into the roof of the mouth. When a bottle is put in the mouth, it doesn't matter what nipple that bottle has on it. It can't mimic a breast nipple. So it pushes the tongue down. So there's a different type of swallowing pattern that's formed. And the swallowing pattern is a big part of that upper arch development. We swallow an average of 800 to 1,000 times a day. And the amount of pressure that the tongue puts into the roof of the mouth is that helping that body grow, and that airway grow, and the jaw grow, and the face grow. We want the face to grow expanded and forward. We don't want it to be retruded. So the tongue is a big piece of that. So if the bottle goes in the mouth, that nipple will push the tongue down, and the whole swallowing pattern is different than when a baby breastfeeds.
Interesting. So having been bottle fed, then it can change the way an adult actually swallows, the posture of their tongue, the way they breathe, and the space for airway that happens here. That's huge. That's huge.
Yes.
It's huge to know that how we take care of our little ones can change the structure of the face and then lead into other things that can happen later in life.
Right.
Yeah.
And this really translates to sleep health, because if our airway isn't developed correctly and the tongue is resting in the floor of the mouth, that can create snoring and sleep apnea, which we have a lot of in this country right now.
Right. Yeah. So snoring, sleep apnea, mouth breathing.
Yes.
Right. So some of that can be aggravated from not having been breastfed as a child.
True.
Right.
Yes.
Okay.
Yes.
All right. That's amazing. But we can't go back, right?
No.
So for the benefit of our little ones, then working to breastfeed is so important.
Yeah.
And then speak just a tiny bit about adults. So let's say we are into our teenagers or our adults, and so just a little bit of the work that can be done if we're past that point.
Yeah. So the biggest thing is we want good, healthy function. And good, healthy function is nasal breathing with the tongue in the roof of the mouth, lips together, and teeth slightly apart. So that's a healthy oral rest posture and breathing pattern. Our nose filters our air, it warms our air, it humidifies our air. There's something that is produced in the nasal cavity and the sinuses called nitric oxide, which is a natural vasodilator and an anti-inflammatory. So it keeps the nose and sinuses open so that we can continually nasal breathe. The tongue in the roof of the mouth keeps the tongue out of the airway. So during the day, it helps us nasal breathe, and at night, it keeps us from snoring, and it keeps the tongue from obstructing the airway. So what I do with the muscles is I retrain them. And so we get the tongue to learn the new muscle patterns to be able to sustain a healthy oral rest posture with continuous nasal breathing, tongue in the roof of the mouth, suction to the roof of the mouth, lips together, teeth apart. So this takes away grinding and clenching. This helps with sleep health. When we nasal breathe, not only do we get all the benefits of what the nose does for us, but also it changes our chemical axis. We retain more CO2, which liberates more oxygen to our brain and to our organs. Our histamine levels go down, so we're less sensitive to the environment as far as allergies are concerned. There's a list, I could go on and on about the benefits of nasal breathing.
So specifically, we want to talk about alkalinity, and then maybe a little bit more about that histamine leading into the possibility of allergies, right? Or symptoms like allergies.
Yes. Yeah. I mean, there's so much that's involved with just getting that correct function. I feel like that's a piece that's missing. We're needing to understand the way that what healthy function is and why. And nasal breathing is the way that we should breathe, and it does all of these things for us, including all of that. It helps with our pH levels, keeping our histamine. Breathing through the nose is like a natural antihistamine. When you're sensitive to allergies, in the environment or seasonal allergies, check in with yourself and see, am I breathing through my mouth or am I breathing through my nose? This could be a key component to why that sensitivity is there.
Right. Awesome.
Yeah.
So I like that. Nasal breathing is a natural antihistamine, right? So bringing your body more into balance just by learning a nice rest posture for your tongue, and then being able to breathe through your nose, and it changes your chemistry.
Yes,
so
it does.
that is awesome. That is just great. And knowing that some of what we started the webinar with was about breastfeeding. So knowing that just the choice to breastfeed your child just a little bit longer, or to search for help if you need help. If breastfeeding is at all challenging, then a check for the baby with a pediatric and focused chiropractic office, as we are, and then checking also with a person that does orofacial myofunctional therapy, so that we know that the nerves going to the muscles are doing good, and then the muscles themselves are doing the right process, right?
Exactly. Yeah. So breastfeeding can be challenging, and if you can't achieve it and you've gone everywhere, then don't feel bad. I mean, there are other things that we can do to help. But if you can seek out help to achieve breastfeeding, it is so beneficial for the baby, not just for that nutrients, but for the muscles of the head and neck, and growing the face forward, and helping the airway develop, and helping the upper arch develop, and then helping the teeth come in the right place. And so it's all connected. So if you can seek out those professionals that can help support you in that breastfeeding and get you to breastfeed as long as possible, then that will help your baby form and be healthier in the long run for so many reasons, not just the nutrients, but that facial development and airway development and teeth development and everything.
The size of the jaw, the size of the sinus, even the look of the lower part of the face.
Exactly, yeah. The mid-face and the lower part of the face, because our mid-face is our maxilla, and this is the upper arch, and the tongue forms the upper arch. So it's really the lower 2/3 of our face is developed from that tongue muscle.
Yes.
The 8 muscles of the tongue that need to be developed properly right from the get-go, right when a baby's born.
That's amazing. Right, that's amazing. So if you are a mom or a parent and you're struggling with breastfeeding, and it's not an easy thing, it's challenging. There can be sore breast tissue. There can be a baby that's fussy because they're not getting possibly enough, or there's some distress. They get a little frustrated. If you're a mom or a parent struggling this, please do reach out. Both of us are happy to help.
Absolutely.
Janae, would you tell them your website and where people can reach you?
Yes, absolutely. Oral Posture is my business, and oralposture.com is my website. You can reach me via email at oralposture@gmail.com or via my website. And if I'm not able to help you, I have a network of professionals, just as Dr. Angela does, where we can help find the right person to support you so that we can get your baby thriving.
Absolutely. Yes. Thank you so much. It's been such a pleasure. Please do search if you are at all struggling, because we are moms helping moms to live a healthier life.
That's right.
Yes.
Yeah.
All right. Have a beautiful day.
Thank you.